In an open letter published in the British Medical Journal, ministers were warned that urgent action would be needed to prevent further loss of life in the future. One of the signatories is the chair of the Council of the British Medical Association, Dr. Chaand Nagpaul, who joins us now. Doctor, a very good afternoon to you. If I can quote just from this open letter, you describe the danger of local flare-ups, which are increasingly likely, and a second wave a real risk. Just in terms of where we stand on definitions, can you help us with what we mean by a local flare-up and how it differs from a second wave? Would a second wave become something we could call that if there was a national lockdown?
Absolutely. So what we mean is that, well, first of all, the virus is still here very much. About 35,000 people in the UK are currently infected. It's highly contagious. You've just heard of examples in Germany where two parts of Germany have now entered a lockdown because of a surge. So we know this virus can go from what appears to be a stable situation into one in which people get infected in large numbers. Now, if that occurs in one part of the UK, we would call that a local outbreak. And an option the government has is to then have a lockdown at a local level. And in fact, that part of the country would not be accessible to others, and you try and contain the virus. And this is precisely why we're calling for a rapid review so that we can plan for such situations. Now, if that spread then occurred across the country, that would be a second spike or a second wave. And remember, our concern as leaders of the medical and nursing profession is that if this happens in autumn to winter, unlike the current first wave of the infection, which occurred in spring, this would coincide with winter flu, when in fact the NHS is already under extreme pressure. So we need to do whatever we can to plan for that and not be complacent or believe that everything's now sort of gone away, because it really hasn't.
And is your focused on making sure we forestall a second wave, so by, for instance, throwing whatever resources we can at test and tracing? Or is it looking more at the infrastructure that is there, if you accept that to some degree a second wave may be an inevitability, not just second waves, but successive waves too, then the infrastructure, whether that's Nightingale-style hospitals, enough ventilators to go around, dexamethasone on hand, all the rest of it? Or is it more stopping it from happening in the first instance?
Oh, it has to be both. The one thing we all want is to prevent further spikes, a second wave nationally. That's what we must do now to prevent that, which is why, from the British Medical Association's perspective, we've also put out some statements around the mitigations that need to take place immediately, given that the government has announced easing the lockdown and social distancing. So that has to be done immediately. Now, if we, however, find that the virus does have a spike, of course, that is where the rapid review should have a proactive approach to how we deal with it, because that does require a very responsive track and trace system that has the right capacity, that is agile, that can give local information and can take local action. Because if those local outbreaks, if that's where they start, are not contained, that's when you develop a national situation. It would also look at issues around the provision of PPE. As you know, that's been a really difficult issue for us as doctors and nurses over the last few months. Come winter, we need to make sure that there's plentiful supply and a sustainable supply. We need to also make sure the capacity of the NHS, is going to be sufficient, not just for the possibility of a COVID outbreak, but also how we will cope with also the pressures every winter and the possibility of a winter flu outbreak that could overwhelm the service. So it's both the immediate to prevent the second wave, plus, should there be outbreaks or a second wave, being fully prepared. And to do this in a way that goes beyond politics, that goes beyond partisan politics, into one in which we objectively, in a non-defensive way, learn from the past. This is not about blame, learning from the past and put in place the right measures, as we move forward.
The timing of this open letter, is there within it implicit criticism of the government's easing of lockdown measures, the scope of them, the speed of them by July the 4th, the decision to go down from 2 metres to 1 metre, or is that reading something political into a document that isn't?
Yeah, I think that's reading, because we put forward this letter prior to the announcement yesterday, and what, however, the letter does do rightly is explain that this virus is far from having gone away. We must now prepare and be prepared as well as we can for the possibilities of further outbreaks and a second spike. And as I said earlier, our aim must be to prevent that second spike. And to do that, we have to be absolutely prepared and do it in a way that isn't about party politics, and bring experts together and use the learning from the last few months and rapidly assimilate that learning into actions that can safeguard our future. So no, the letter was prepared prior to the announcement yesterday, but it's absolutely pertinent in light of yesterday's announcement on easing of lockdown.
And just watching Prime Minister's questions today, it was obvious that opposition politicians have serious misgivings about the performance of the app that was initially developed and to some degree ditched now. UK seems to be falling back on a more traditional pen and paper telephone detective work system of track and trace rather than something with technological bells and whistles. How worried are you by that?
Well, remember that the easing down of lockdown was, the initial easing down was predicated on a commitment that we would have a world-beating app. Now, testing and tracing is fundamental to controlling this infection, because that is the basis of how you identify infection and how you isolate those who are infected and those who've been in contact with infected people. Now that was all contingent on an app. Now that that app is not functioning, is not available in the way it was intended, we have to make sure we are prepared through more traditional public health measures. And that is why, again, part of this review would want to put in place those measures and to give confidence to the public that this is being done not through a political decision, but one that brings together the profession too and public health doctors across the nation. So yes, you're absolutely right. This is one of the real risks we currently face, is not having the agile and capacity of a test and track system that works in real time should there be outbreaks.
Dr. Chaand, Nagpaul, good to talk to you. Thanks very much indeed. Thanks for your time.
Thank you.